Welcome to the Explainer. Today, we're going to tackle something that might sound a little clinical, maybe even intimidating, ostomy care. But our goal here is to strip away all that complexity and turn it into a super clear, empowering guide to living well.
So let's just start with a number, 70,000. You know what that is? That's roughly how many Canadians are out there right now living full active lives with an ostomy. It's way more common than you might think. Okay, so let's get the basics down. What is an ostomy? Well, simply put, it's an opening that's surgically created on the abdomen. Its job is to let waste leave the body. And that little opening you'd see on the skin, that has a name. It's called a stoma. You're going to hear us talk about both ostomies and stomas, so it's good to have those terms down.
All right, so here's what we've got on tap today. We're going to cover what an ostomy is, the three main types, the whole appliance system, how to manage day-to-day life, and then we'll wrap up with some common challenges and, more importantly, the solutions.
All right, let's jump right into our first section. What is an ostomy? And, the why behind the surgery. People get ostomies for a whole range of reasons. It's not just one thing. It can be a totally life-changing treatment for things like inflammatory bowel disease, Crohn's or colitis, or for colorectal cancer, even for a serious injury to the bowel. But no matter the reason, the goal is always the same: to bypass a part of the system that's damaged or diseased, all to improve someone's health and their quality of life. Okay, moving on. Let's get into the three main types of ostomies you'll hear about. This table does a great job of laying it all out. So you've got your ileostomy, which comes from the small intestine and its output is more liquidy. Then there's the colostomy from the large intestine, where the output is more solid. And finally, the urostomy. And the name kind of gives it away. It diverts urine. Where the ostomy is located, that's the key. It determines everything from the kind of appliance you need to what your daily routine looks like. And it's super important to know what a healthy stoma should look like. You're looking for something that's shiny, moist, and has this nice dark pink or reddish color. But here's the really wild part. A stoma is actually made from the lining of the intestine, and that tissue has no nerve endings. So what does that mean? It means it can't feel pain at all. That's something that really surprises a lot of people.
Okay, so how do you manage all this? Let's take a look at the ostomy appliance system. Think of it as your modern-day toolkit for confidence.
So generally, appliances come in two main flavors. You've got your one-piece system, where the pouch and the skin barrier, that's the part that sticks to you, are all one single unit. Then there's the two-piece system, where they're separate. That means you can just pop the pouch off and change it without having to take the barrier off your skin. Which one's better? Honestly, it just comes down to personal preference. What feels right for you and your lifestyle. And hey, it's not just about the pouch itself. There's a whole world of accessories out there to really personalize your care. We're talking powders to keep the skin nice and dry, pastes that help create a better seal, belts for a little extra support, and even special guards you can wear for protection if you're playing sports. Pretty cool, right? All right, now let's get to what's probably the most important part: how this all fits into daily life. It's all about routine and control. Look, what seems super daunting at first, I promise it quickly becomes a simple, totally manageable routine. The steps are pretty much always the same. You carefully take off the old appliance, gently clean and dry the skin, make sure the new barrier is cut to just the right size, and then apply it so it's smooth and has no wrinkles. Getting that good, solid seal, that is everything. It's the key to being comfortable and secure. Now, for some people, specifically those with certain types of colostomies, there's this other option called irrigation. What is it? Well, it's basically like giving yourself an enema through the stoma. It lets you empty the colon on a schedule you choose. And if you get into a regular routine with it, some people find they get so much control that they don't even need to wear a pouch all the time. Pretty amazing. Okay, let's talk about food. Diet is super individual, right? What works for one person might not work for another. But there are some foods that tend to have predictable effects. This table here is a fantastic starting point. You'll see things like fish or garlic, which might cause more odor, or broccoli and beer, which can create gas. Then you've got things like pasta or bananas that can actually help thicken the output. Honestly, one of the best things you can do is keep a little food diary to figure out what your body responds to.
Okay, but let's be real. Challenges can pop up, so let's talk about how to navigate those, because knowledge is power, right?
So what are the most common hiccups people run into? Well, by a long shot, it's issues with the skin right around the stoma. That's called the peristomal skin. But here's the good news. Almost all of these problems are totally preventable, and if they do happen, they're treatable with the right care.
So here's a quick rundown of the usual suspects and how to fix them. If you've got irritation because of leakage, the very first thing to check is the fit of your appliance. If you're seeing redness and it's itchy, that could be an allergy, and sometimes just switching to a different brand solves it. For things like inflamed hair follicles or even a fungal infection, it often comes down to simple hygiene, like shaving the right way and really making sure the area is dry. See, every problem has a pretty logical solution.
Something else that's really, really important to know is that an ostomy, especially an ileostomy, can change how your body absorbs medication. Think about it. Things like timed-release pills might just pass right through your system too quickly to actually do their job. This is why it is absolutely crucial to talk about every single medication you're taking with your doctor or pharmacist. Can't stress that enough. So, what's the big takeaway here? What's the bottom line? An ostomy is not a barrier to living a full life. Seriously, most of your regular clothes will still fit just fine. You want to exercise, play sports, go swimming? You can. It's all totally possible with today's appliances. And for things like travel or intimacy, really all it takes is a little bit of planning, like packing some extra supplies or using a discreet pouch cover. You know, this quote from our source material just hits the nail on the head. It says that with education, people with an ostomy will continue to enjoy their previous quality of life. And that's it right there. The number one most important thing is education. When you understand your body and how to care for it, you can keep right on living the life you want. Knowledge really is empowerment. And that really leaves us with one final thought to chew on. When you replace all that uncertainty about the how do I change this? How do I eat? How do I fix this skin problem? When you replace all that with real practical knowledge, it totally changes how you see the why. Suddenly, an ostomy isn't a limitation anymore. It becomes the very thing, the solution that lets a full, vibrant life keep on going.